Hello, doctors, students of homeopathy, and friends of homeopathy. Today is the 1851st day of uninterrupted daily webinar of IFPH. And today, our guest speaker is Dr. PRAKASH RAO. He is an MD and PhD holder in homeopathy, and also he do have a PG in rehabilitation medicine. He is a former research officer, CCRH, Government of India. He do have more than 30 years of experience at CCRH. Dr. PRAKASH RAO undertook projects with UNICEF and AIDS Control Society. And today, the topic is infertility, homeopathy, and research. Let's welcome Dr. PRAKASH RAO, and I welcome you all for the session. Just a minute.
I will be joining soon.
Okay, doctor, thank you.
So you can talk about our celebration here.
You can, sir. You can, please. Dr. Help.
Good evening, all. As you all know, the International Forum for Promoting Homeopathy is celebrating its 5th anniversary on 28th of September, that is coming Sunday, from 8 a.m. to 6 p.m. And we have arranged a lot of sessions in this celebration, and the celebration is to be inaugurated by our Aish Minister, Central Aish Minister, and thereafter a lot of eminent personalities are talking in the session, and followed by from there will be scientific sessions also. And the most important aspect is that in the evening there is a special session, that is veterinary and homeopathy session, as well as dental homeopathy. And later there will be agro-homeopathy by Dr. Vaibhav Jain. And from 4 p.m. onwards, there will be cultural presentations also. Please join. Only 3,000 per person even now. And those who come with another accompanying person can pay 5,500. Please register for the same. If you people come there, we can meet one another, we can see one another, we can discuss homeopathy. And there is one of the most interesting aspect of our session is that there is a discussion session with the media person, so that they will cover up homeopathy in the coming editions of our sessions as well as in the newspaper, so that more and more people will know what can homeopathy do in contagious as well as infectious diseases, its treatment, its management, its prevention, etc. Hope all of you will register for the same. Thank you.
Thank you, doctor. And we are all on excitement because on this Sunday itself, we are all meeting. And we are having very eminent persons, which Dr. Dhanesh mentioned. We do have wide type of sessions, persons taking keynote speakers also, and also taking short sessions, and also some interactive sessions are being also arranged along with cultural programs. And it is being held at Taj Vivanda. It's a great thing because it's the center part. We are staging it in Cochin itself, and it's in the central Kerala. And great ambience is being meticulously, we are planning on that. So it will be great because 5 years, continuous webinars, lot of, you all know, lot of sessions we carried out. We are having daily lot of insights, getting a lot of insights in homeopathy. And from that itself, we combed a lot of persons, and these persons are taking the sessions. And our guest has joined. Let me make him the co-host.
In two form.
slides. Today topic is infertility. The total world is what is infertility? What is the definition of infertility? The infertility is if a couple having sexual intercourse for more than a year without any obstruction, and if they are not conceived within a year, is known as infertility. Without any obstruction, if couple meet for a year and if there is no conception, it is known as infertility. See, many people will define infertility as 1 year, 2 years, 3 years. No, for a year regularly, if they meet and if the conception is not taking place, is known as infertility. Now, whatever slides I have uploaded to you, which I remember, I will speak to you. Now, the total world population is around 48 and less than 48% of couple are suffering from infertility. The infertility rate is more in America, in Germany and France. The reasons are number one, geographical, because of excess cold, the spermatozoa percentage will be less. The production of spermatozoa will be very less. But whereas in America, the infertility is because of obesity. The obesity will bury the ovaries as well as the testicles in male person. So the testicles will produce total spermatozoa, but the fertility won't take place because of the obesity of women there the present. Now, previously the obesity rate used to be 1:1,000, 1:100. Now in America, every fourth person is an obese person. So that obesity is stopping them. Now come to India. Even in India, the obesity is threatening and going to become another pandemic within 5 years. So that obesity will bring the PCODs. All the PCOS syndromes will come because of obesity in women, where the hormonal cycle will be disturbed and the hormones appropriately, particularly follicle stimulating hormone and the estrogen rates will come down, so that the ovary will bulge, and the bulged ovary, where the ovaries are not being secreted, they will be inflamed, and around the ovary there will be accumulation of water, and ovary size will be very small. Because of the small size of the ovary will not be expelled from outside, so there won't be any bleeding, or there won't be any, because of water present around the ovary will not take the fertility. So though the sperms are high, the fertility rate will be very less. This is number two. Number three, in male, usually sexual impotency and production of spermatozoa is nowadays becoming less because of obesity and diabetes. Because of diabetes, there will be hypertension, and the diabetes has reached so much that 1 in 4 person, if there are 4 persons are standing somewhere in the street, means there will be one diabetic patient, and that diabetic patient will have inside the infection. That infection may make his body imbalance. That imbalance will produce, there will be weakness, and that weakness ultimately results into production of less spermatozoa, as well as the complication of diabetes, particularly hypertension, that will give erectile dysfunction, so that the male side infertility is one of the cause. The female side, the diabetes will make the periods irregular, because if one hormone chain is being disturbed, the other hormone chain will be disturbed. So when one hormone, the insulin, is being secreted less, means the estrogen, the progesterone and follicle stimulating hormone also will be secreted less. So the ovary will become a PCOS condition. Then endometriosis is other condition. It is an infection. It is a hormonal, it is a genetic disorder, and that genetic disorder will pass to endometriosis. In endometriosis, what happens? the endometrium of the uterus, the tubes of the uterus, and the ovaries of the uterus will grow and become a chocolate like of cyst, and that cyst will pass into intestines, and endometriosis is other cause of the infertility in female. So enormous studies have been carried out in infertility. First, we will come to modern system of medicine of infertility. Now, because this infertility became a common problem, and 48% of the couple, less than 48 or up to 48% of the couple, married couple, are not having children. So nowadays you will see in every small town there will be infertility clinic. What they will do is they will take in vitro fertilization. They will take the ovary and they will take spermatozoa. They ferment in a tube. Then they inject that fertile ovum or that zygote into the mother's womb, and they will see an artificial atmosphere because of hormones being conducted in the uterus, and that uterus will continue for 9 months. Then childbirth can be given. This is their way. And there here, what happens? The minimal treatment in the beginning, the PCOS has originated means the pregnancy will be delayed in females. So a PCOC must be always addressed properly. With if the hormones are less, they will apply the same thing. Usually, the metformin which will be used for diabetes mellitus is one of the strongest remedy from their side, so that the metabolism of the body will be changed, and the metabolism of the body changes because the obesity is going to come because of diabetes. So the ovum become normal, and there will be menstrual regulation will be normalized, and fertility will take place. Now come to homeopathic side. Without any side effects, without any bad effects, there are selected medicines definitely will make the ovary not to get inflammation, and the size of the ovary will be managed automatically and naturally. The lifestyle disorders will be rectified once patient practices some lifestyle disorders measures, that is lifestyle saving measures. Then if the homeopathic medicine is introduced, the infertility will come down, and the PCOS condition also will come down. There are various tested medicines research basically. Now this is about homeopathic approach of PCOS. Later we will come to infertility in females, where the spermatozoa will production will be very less. This research also has been carried out. We can increase the count of spermatozoa in females by giving homeopathic drugs, particularly the intestinal tissue of the ovary of the testis will be stimulated, and the intestinal tissue will encourage spermatozoa to be produced more. By that, if 90 million and more spermatozoa is present, the spermatozoa will meet with ovary, and there will be zygote formation. Now this is about male. Now what are the disease, what are the specific medicines that have worked? Why I am using specific medicine is, in homeopathic literature, there are various medicines like nosodes, sarcodes, hormones, because we will take here sarcodes. Sarcodes means uforbinum, or we can take luteinizing hormone, we can take testosterone, we can take progesterone, we can take estrogen. But these hormones, they are proteins. Once they are prepared in homeopathic form, if they enter into the body, they will not be so effective as the hormones that are being effective outside the clinical studies. But when they enter into clinical studies, because of their protein properties, they fail physiologically to induce the expected action. So homeopathy is having various types of medicines which will definitely will affect the PCOS condition. That PCOS condition, one of the best remedy that has been proved and found to be 30% effective out of 100 PCOS women who are infertile. The first remedy is Sepia 30, daily 1 dose for 3 months. And gradually, the menstrual cycle first, it will be regularized and the ovary infection will come down. Once the ovary comes into normal size, if the at that place, if the couple meets, there will be chances of pregnancy. And out of 100 persons, the sepia has produced 30% response. Then come to natramur and pulsatilla. See, their interaction is on metabolism, particularly pulsatilla's metabolism is on liver. It decreases the liver's fat, then it decreases because the liver fat comes down, the blood sugar comes down. Once the blood sugar comes down, though they are not diabetic, the normal range of the blood sugar in a healthy woman will be managed by that. The follicle stimulating hormone will secreted in a normal range and the ovary infection will automatically comes down on both the sides. But the treatment time needed is around 6 months. And after the 6 months of the period is over, there will be chances of a woman becoming fertile. The efficacy of this medicine has been found out of 100 in specific 30 potency and lesser potencies. That means 12C and 6C found to be more effective than 30 potency. 30 potency do produce result, but it is not like that 6C and 12C. They have produced more cases, the positive result in more cases than in 30 potency. So that also will help to relieve the infertility condition. Now come to other medicine is natramur. Natramur is a medicine that usually will be given for females and for various condition, migraine to irregular periods to periods not coming and mood swings, everything. But the natramur is basically works on a human being. It removes the anemic condition where the anemic condition will come because of excess the excess bleeding is estrogen production ultimately causes the infertility. To remove that excess production of infertility, the natramur will work. That's why the anemia in natramur is because of severe bleeding, and that anemia will be removed with natramur condition because it increases the sodium content. It contains the sodium that will make them to not to dehydrate, and by that it also will control the bleeding, and ultimately control of the bleeding will leads to increase of hemoglobin. Increase of hemoglobin will stimulate the luteinizing hormone, estrogen, and ultimately a infertility condition will be relieved and the infection in the ovaries will come down. These three major remedies have been found very effective in female cases. When the cases were studied, out of 100 cases, 30% efficacy has been found with these three medicines. Each medicine produced 30, 20, and 20. So for 20 plus 30 plus 30, but when we have taken the sample size more and more and more and more, the efficacy rate has come down because when in biostatistics what happens, 30% of the medicines will be taken all together, one and one medicine each together. So the 30% efficacy with sepia is different from all the medicines combined together. The 30% of the efficacy will come. And out when we tested 100 cases, 70 cases have failed in the sense the menstruation cycle was normal, but fertility never took place. The menstrual cycle was irregular, but in some of the cases, fertility took place. So the success rate was more than 30 and 31%. And failure in the sense the net result that has been found is around in failure cases, not responded cases, is 70%. The duration of the treatment is from 1 day, 1 month to 6 months. So the maximum duration of the treatment needed in 30% of the success cases was around 6 months. and the minimum duration of the treatment that was needed in around 10 cases is 1 dose of medicine and one-time medicine. So the medicine will differ depending upon the individual. So the attending physician has to understand and the physiological conditions, the local environment and local attending physician with the expectation and experimentation with the hormones will relieve and remove the infertility in women for about 30% out of 100 cases. Now come to male infertility. In female, I have forgotten to tell one medicine, that is uforbinum. Uforbinum specific medicine in 6 potency has also shown enormous expected result in a woman who is having not obese personality, where there will be severe pain. Maybe this may be because of the cyst or endometriosis, and that will relieve the uforbinum as a sarcode. It has been found to be effective. And the other rarest remedy, in the sense usually one won't get into idea. Somebody may think simisfuga, but it is not simisfuga. It is the murex, that is the medicine which will cure. There is one cure guaranteely one homeopathic doctor can claim and boast is endometriosis. The endometriosis is deemed as a pre-cancerous condition in modern system of medicine, but the endometriosis is curable with the medicine murex in low potency. Why I am talking stressing low potency is the whenever we do experimentation on per the scientific lines, there the controversy of high potencies will come. They will tell that your high potencies are nothing but placebos and we can't trace out any medicine. Some of the homeopathic doctors will claim that the nano medicine is present in high potency. There is no doubt nanoparticle will be present in anywhere, in anything. It need not be high potency or high dilutions. It can be present in water, the nano water particle, the alcoholic particle, the medicine particle. The nanoparticle will be present in any dilution, in any metal or in any material. But when the nanoparticle of the homeopathy that is present in high vehicles, high dilutions, it is not being converted into clinical action. When the person takes the nanoparticle present medicine, it will be neutralized over the saliva itself. It never enters into the body. The saliva will have antibodies. It recognizes the foreign particle, and when the medicine is put over the tongue, automatically the antibodies which are being produced by the body will make the antigen nanoparticles that are present in high dilutions, and it's absolutely neutralizes, and the nanoparticles are not being converted into medicine. Whereas the physiological dose, suppose if we give 6 potency or mother tincture or 3x or 6x, 6C and 12C, if we take the urine samples, if we take the sweat samples, the medicine is present in the urine content and we can trace out the medicine. That means it reaches total body and it is in low potency with high diluted medicine. So it may it may produce immunomodulation and it ultimately cures the disease. But whereas in high potencies, this has not been observed in the laboratory. This is where the clinical research as well as in vitro studies will show. In our in vitro studies over phytochemicals by various authors, they found to be very successful. But when they are converted into clinical side, suppose you can take Fucus religiosa or Fucus versicollis, both the medicines they fail because clinically, physiologically, they will be highly effective. But when they have been prescribed as to the patient, the physiological dose will not be converted into clinical medicine, and clinically it will be very less effective. Therefore, the repeated doses must be given. In the homeopathic potency also, when we give low potencies, The enough potencies will stimulate, trigger the immunomodulation and makes the hormonal diseases to the normal condition. This is the where the mother tincture theory came out, because when the original medicine for diabetes was not working, Syzygium jambolinum, Cephalandra indica, other mother tinctures have been tried. Gurmar, these mother tinctures have been tried and they have hypoglycemic effect, there is no doubt. But the mother tinctures are not being considered as good homeopathic medicines, and their purification, their quality control, their reproducibility, their medicine action is totally physiological, can be assessed by anybody, and the physiological of the medical botany results are the same like homeopathic mother tinctures. So it will not be the similia similibus curenter principle is not being followed in mother tinctures, except because the mother tinctures are not being proved. So these are some of the troubles in homeopathy. Now come to male infertility. In male infertility, what happens? The spermatozoa count has to be increased. So when we did clinical verification means studying the total books. So when we studied all the books, see, Lycopodium comes first, because then Silesia comes first. It also induces spermatozoa count, and Lycopodium also induces. These are all not symptoms that have been produced on human beings when the medicine proving has took place. Sir, can you hear me, sir? Hello?
Yes, sir.
Can
Yes.
you hear me, sir? Yeah.
Yeah, sure.
So these are the conditions. Now what we did is, what is that Agnus castus and how it produces? When the animal testing has been done, the Agnus castus has shown wonderful results, and the Agnus castus has improved the spermatozoa count, and spermatozoa counting so much that around 90 millions of spermatozoa can be. See, even if one spermatozoa is present in the body, we can make the interstitial cells of the testis to produce spermatozoa with Agnus castus and yohimbinum. Yohimbinum is a neuromuscular stimulant. In yohimbinum, the neuromuscular stimulant will remove the impotency, but its action over the spermatozoa is little less. We cannot compare Agnus castus as effective as yohimbinum is not as effective as Agnus castus. Why these medicines were taken means the specific medicines they have been given. So whenever a homeopathic doctor thinks the attending totality of the symptom basing the constitutional medicine. If you compare with male infertility and female infertility, the male infertility needed a medicine that is specific for disease, whereas in female infertility, the medicine is required for constitutional prescription, sepia, natrimur, palastrella. Whereas in females, it is Agnus castus, yohimbinum. Why this change is so much? That means somewhere the pathological prescription is needed, somewhere the total constitutional prescription is needed. Why this difference has come? Because when we want to treat the patient holistically, one single principle can't cure all the disease conditions. A similia similibus curenter will cannot be applied in all the cases of the patient. Suppose we ourselves will study from our homeopathic philosophy that Kent used to give preventive medicines for a newborn child. If you read Kent tuberculinum, he advised give tuberculum 50 millismol potency to prevent a tubercular condition. In the same fashion, he asked to give sulfur potency to make the patient not to develop sora. But whereas a psoriatic condition may be treated with the sulfur in a patient or not, but his perception was we also can prevent the psoriatic condition in a pregnant woman by giving sulfur. So a preventive medicine can't be a curative medicine. A curative medicine can't be a preventive medicine. if you apply this same law or to understand, I will give you one example. Vaccination for polio. The polio vaccination, it will prevent the polio. But the polio, once the polio comes, if we give vaccination, it never cures. And even temperature also won't come down. The protein that has been swallowed in booster doses or the injection that has been given intramuscularly, the protein will be dissolved by the digestive system and the child will go for atrophy of the limb muscles. In the same fashion, the similibus curanter, in some of the cases, with one principle, the holistic total human concept can't be approached. This is the limitation of the homeopathy where we have to understand. That's why what allopathic doctors will do, they follow similia similibus curanter, isopathy, vaccination. They also go for antipathy. They go for surgeries, which has been introduced in homeopathy also. Hahnemann, in his Organon of Medicine, he described the disease condition and the classification of the disease condition into curable, incurable cases, surgical cases, which need surgery, where the surgery has to be applied. After surgery, what are the medicines have to be given, the post-surgical medicines, everything he discussed. And this, whenever we cure, this principle will not be applied. So, being a homeopath, the similia similibus curanter can be applied to 70% of the medicinal diseases, not to 30% of the surgical diseases, and some of the 10% of the diseases which needs the other type of treatment like pathological prescription, the local prescription, like applying arnica mother tincture or hypericum mother tincture to heal the wounds, or the calendula mother tincture to heal the wounds properly. The calendula mother tincture will kill the local bacteria and virus. So the skin growth will be very fast. The skin growth is natural, but calendula will kill all the bacteria, and it also prevents the bacterial growth for further 3 days, not like antibiotics which have to be taken daily. So these are some of the homeopathic, medical, internal, pathological reactions. So these will make the medicinal action, will make the infertility to come down. Now, when we compared with our study with allopathic study, the allopathic study and homeopathic study has equal response, in the sense, even in the infertility in vitro studies, if they do 100 in vitro infertilization, they are also getting only 30% of the success. 70% of the cases won't respond for the first time. The second time, another 10% of the cases will respond. So 30% and 10%, 40%. If we compare with homeopathy, homeopathic medicine also is treating the cases for about 40%. One is one constitutional basis, second is pathological prescription, third is understanding the disease condition. The infertility has been cured. They are evidence-based cases are present. Evidence-based material is also present, which I would like to submit in my. These now slides are present, but unfortunately I don't have today. Now just I started my lecture. The electricity has gone. Here it is heavily raining. So I would like to produce my slides, which have been found to be highly effective when we have carried out in vitro, in vivo, and success cases of the pregnancy. I will show in my second lecture. So this is the where homeopathy will be very effective in the cases of infertility. Many people will think there is one here, one we have to take home message is PCOS and endometriosis. If an unmarried girl comes, we have to start treatment so that after marriage, her fertility after marriage will be early. So all the PCOS cases must be addressed. In the same fashion, in a boy, where if they happen to have any mumps, past history of mumps is present, when he comes for treatment with cough, cold, coryza, and when we take past history, if the mumps disease was present to him at the age of 4 or 5, along with the blood test, you also can go for spermatozoa count, so that the mumps will affect the interstitial cells of the scrotum. By that, the scrotum either will be totally ineffective, or the interstitial cells will be totally ineffective of producing spermatozoa, or they may produce spermatozoa below 40 million. If below 40 million comes, even that patient won't be eligible for in vitro fertilization by allopathic doctors, because when they collect spermatozoa and store, there will be only around thousands of spermatozoa that will be motile. In the same fashion, we have to help the allopathic doctor, means you have to increase the spermatozoa around 60 million to 70 million. Then only the in vitro fertilization for that couple will be successful. This is the use of homeopathy as an adjuvant medicine. Where they don't have that one, they will give testosterone. Testosterone will increase the body strength, and it increases the growth, and it increases growth hormone. Thereby, he will get muscles. But the testosterone production will relieve the depression also. But the testosterone supplement cannot improve the spermatozoa. And they also will give other hormones like melatonin and everything that produces stress free, that produces sleep, and patient never thinks. But there is no direct medicine that will work on interstitial cells of the testis, whereas in homeopathy there are 2 to 3 4 medicines that have been found pathologically, their mechanism of action has been understood. They will increase the spermatozoa count. That is, one of the medicine is Agnus castus, and second medicine is Yohimbinum, and the third medicine where the 2 to 3% efficacy will be present, that is Silesia, and Lycopodium will be very less effective, but it will have 1% of the efficacy. Why these I am telling 1% of efficacy, 3% of efficacy, 10% of efficacy means when these medicines have been proved on healthy human beings, there are the provers for Lycopodium, provers for Silesia were more, and nobody has tested their spermatozoa at that condition. But when clinically verified, when patient came for treatment, when the Silesia physiological structure is over the test, and it is will stimulate the testicular interstitial cell and spermatozoa, and this was being observed. Some of the new experiments which are being conducted with silesia and salt, or silesia salt also, have been found when they were given to fish, the spermatozoa condition has increased. When they were given to the monkeys, the spermatozoa condition also increased. So, say many people across the world, they will add something, they will connect something without knowing the knowledge. But it seems to be that performing the Shiva, or performing the stone, or the structure that has derived from sand, is having effect over the spermatozoa production. And some of them even argue that the spermatozoa production will be more, and the Y chromosomes will increase, only male birth will takes place. This they will claim, but this has to be scientifically accepted. More studies are needed. Just I am out of interest, I am telling. So these are some of the remedies. And the other remedy is Naxvamika, where Naxvamika will stimulate the mental system, mind, stress, and that stress, particularly the interstitial cells, are the cells that have been affected with infection, inflammation, and alcoholic metabolic syndromes, and other metabolic syndromes. These syndromes will be relieved. The infection will come down along with the allopathic medicine. If he is a diabetic patient, if the spermatozoa count came down, so adjuvant medicine can be Naxvamika, the spermatozoa count won't come down. Diabetic erectile dysfunction, This can be also applied to lycopodium, where the erectile dysfunction will come down. There we needed is constitutional prescription to avoid the erectile dysfunction as well as spermatozoa production. And for a non-diabetic patient, a direct remedy is Agnus castus and yohimbinum. In female also, the uforbinum is a medicine to regulate the ovarian functions and relieve and remove the infection of ovary by giving uforbinum, whereas for other conditions like endometriosis and PCOS, one side, both the sides. So that needs a specific constitutional prescription in homeopathy. And I will show my slides. I will try to my level best to complete my lecture in my second session. Here there is no current. Now I would not like to speak. I request you to question something. I am very sorry that I am not sharing my slides today. Now, because I have to speak from my mobile phone, I have to show my slides from my desktop. I don't have laptop. You have to excuse me. You can have a discussion if anything, and kindly go for discussion. There is around 15, 12 minutes time is left. Sir.
Thank you, Doctor. The session was excellent. We can understand the situation because with slides and all, we can make that in the second session itself. So it's a time to interact with the speaker. You can raise hands. The reaction list, you can. So according to you, by proper case taking and selecting the medicine, going higher potency is for the correction of this infertility. It's not wise. On at least on a research purpose, but the benefits of research purpose, we need to.
You are right, sir. But in our laboratories, what happens when we conduct research in allopathic hospitals, the ethical committees will object. I, as a homeopathic doctor, I am not opposite for higher potencies. But as a researcher, I can't conduct the research because the ethical committees will say that your higher potency do not have any medicine. So don't experiment your placebos on the patients. So as a homeopathic doctor, I would like to test higher potencies. But as a researcher, we need fundamental research and we have to know what is what so that we can give guidelines to the physician. So our hands will be tied. We cannot educate them until and unless we cure our own fundamental problems like the presence of medicine in the potency and dilution standardization, pharmaceutical standardization. What is pharmaceutical standardization means? Suppose we will take the company names, I will explain to you so that you will understand very well. We are not biased or anything. We do not want to criticize anybody's their aim and logic. See, suppose if we take Byron, Sharada Byron company, he will add 60 to 40. 60 is 40. That means 60% of the alcohol, 40% of the water. In this 40-60%, he will mix, for example, I am taking a medicine Spigelia bryonia, and he will prepare the mother tincture out of that. And from his mother tincture, he will take 1x potency, 2x potency, 3x potency, 30 potencies. So whenever we experiment, our problem is that we have to write in our experiment that we are testing our drugs with Sharada Byron Homeopathic Pharmaceutical Company, and this efficacy is with Sharada Byron Homeopathic Pharmaceutical Company. Whereas in allopathy, if you take paracetamol 500, every pharmaceutical will have the standard pharmaceuticals. I am not talking about bogus pharmaceuticals. They will have the 500 milligrams of the drug. Number two, if we go from Sharada Byron to Box and Company, the Box and Company will add again 70%, 30%, 10% there. That was 60. And here is 70% alcohol, 30% of water. In that alcohol, in that what they do is, they will add 0.06 corticosteroid. The 0.06 corticosteroid is allowed by the government of India and everywhere, because it never produces any side effect, bad effects or contraindications. These are the corticosteroids which will be given to chicks so that they will produce daily one egg. Even for milk, when the cow wants to give milk, so they will give estrogen hormone more and lactating stimulate hormone more. So the cow will give around 20 to 35 liters. So in the same fashion, 0.06 corticosteroid is added. Some of the people went against him, and there was also court case. But 0.06 hormone is allowed, and not hormone, the steroid is allowed. And so every medicine will contain 0.06 micrograms mu of steroid. And if you give Sarada Byron medicine, you will get success with any potency, any medicine for any disease. You can give Zincum metallicum for cough. Cough will be relieved, because it is not the symptomatology that works. In the beginning, it works. Number one is placebo effect. Number two is the presence of steroid. Number three, you take Hapco. He will add 95% of the alcohol, 5% of water. So his mother tincture preparation, his pharmaceutical preparation is entirely different. Come to the Kerala State Homeopathic Pharmaceutical Company, Cooperative Pharmacy. They add 40% of alcohol, 60% of water, and their medicines also found to be effective. So when their succussion ratio also, suppose the Byron company will give succussions with computerized succussions. Baxen will give computerized succussions. Hapco also uses manual as well as computerized succussions. These computerized succussions, all the computerized succussions machines are not of the same product. Their succussion speed, limit, and the per minute succussion will differ from each company to each company. When we do pharmaceutical research in this, we will find the difference of medicines present in 3-4 different pharmacies. So when the equipment infrastructure is not standardized, how to standardize the potency? When we standardize the potency, which potency we have to study? The standardized potency. So these all are hit, and after 70 years of independence, and these problems nowadays everybody is understanding, but nobody is making them to progress. Now there is a committee from CCRH, and there should be instructions to be given to follow the standard uniform pharmaceutical infrastructure. That needs parliament enactment of the rule, that needs a bill. So that bill could be questioned in court. So somebody has to go to each pharmacy and see, and they have to submit a report. For that purpose, the CCRH has appointed one person to look after all these things. Now they came to alcohol medium, a standard alcohol medium, but not standard alcohol infrastructure. You can see this. That's why one physicians who are very busy, they will say that this pharmaceutical company medicines are good. It is not that they are biased, because in their clinical practice they will suffer so much that they want their efficacy of the medicine should be excellent, and they want to get excellent name from patients. So they will tell this company medicine in 30 potency is very good. That medicine is genuine. This pharmaceutical company is genuine. Everybody seems and brushes it out as an opinion of the physician, but when we found out, they are right. And a physician always, he is the person who will be in the battlefield with the patients to decrease the disease. But as a researcher, I always feel, though so much of research has been done by me, and whatever I am contributing to the physicians, some of the things where the government and think tank at higher level, they were not brainless, they do not know anything. Our think tank, particularly the decision makers and planning makers, if the secretary comes, the research priorities will change. If the director comes, the research priorities will change. But whereas in ISRO, If Chandrayaan has to go with the former director or new secretary, it will go with the old secretary as well as a new secretary. If atom bomb has to be produced, if the previous government has taken the decision, the present government also implements. But whereas in homeopathic research, if the previous secretary is changed, the research priorities will change. This is the unfortunate condition. You kindly note down. I request Dr. Dinesh to note down my points and kindly speak and give a louder voice to the think tank. Mere IAS doesn't mean that because we don't have any care in the status. Why we don't have any status? Because the science is not being properly understood. So these are some of the difficulties in homeopathy where we cannot prove the higher potencies. We cannot see the higher potencies experimentation because the ethical committees won't agree. Why we don't see higher potency experimentation successful? Because the higher potency medicines are deemed as placebos.
Thank you.
This no homeopathic doctor, when I discuss with my colleagues, my research colleagues, they never accept. But the fact is fact, we are facing the same difficulty from WHO. WHO has warned the people not to take homeopathic medicine for tuberculosis and HIV/AIDS. And despite of all these things, our homeopathy doctors, they never think what research is urgently needed. See, they do experiment on cancerous patients. They will forget how to prepare a 30 potency. So it is left to Dhanesh and team to look after these issues and teach and explain, learn, make them to learn that what research is needed. So this is my request with why I am associated with IFPH whenever Dr. Dhanesh telephones me, because I want a voice too that requires what is the research required in homeopathy. It is not the fund or it is not our will and wish that needed research. See, I carried out research in rheumatoid arthritis, but how to carry out research on 30 potency? So these are the troubles.
Thank you,
As
Dr.
you questioned, your question is valid, sir.
It's thought-provoking. Sure, we need more attention. We need more research on this field. We need to shed more light on this thing itself. Sure, we will take up this case, and you please lead the light, sir. Should come again in this forum because we need more in this thing itself. We need more clarity and thoughts, because as practitioners and clinicians, we all know that higher potencies are very beneficial, and taking the totality itself, like the health of several persons. So will be we don't have any scale to calculate the health of a person with the same disease. Likewise, the potencies also should be varied, should be selected according to the health and the state of the level of the thing which we need to calculate on that itself. And as a researcher, we can understand what you said. It's really, we need to ponder on that. So,
Sir, Dr. Geeta ji want to ask one question. She raised something. You kindly, Dr. Geeta ji.
Please, Dr. Geeta.
Particular. What she want to ask, sir?
No.
Dr. Geeta.
Yeah.
Yes, I can hear. Please speak. Yes, madam.
There is a question. Is there any specific medicine available for treating tubal blockage?
Yes. There are specific medicines, madam. There is no doubt. You kindly try Simisviga and Murex. Simisviga will bring down the neuromuscular pain. And neuromuscular pain means which comes from the phrenic nerve, and the pain will come down. And see, if you don't mind, I will tell you some of the neuromuscular painkillers: Beriberius virgalis, Pereira breva, Cantharis, Cannabis indica. They will act on uterine system, but the same production of the medicine, the action will be same. You kindly try specific medicine. The tubal black will come down, and you kindly try. The tubal black is coming means the patient is going for endometriosis. So kindly try the Murex medicine. It is a specific medicine. And endometriosis, whatever may be the stage, is curable in homeopathy. You kindly believe me. This nobody knows. CCRH has published the only case that can be completely curable, which is not curable in allopathy, is endometriosis. And Murex is the drug of the choice. Not drug of the choice, the only drug. You can get it and you can cure it. Yes, sir.
Thank you, doctor. And it's now time to conclude.
Thank you very much, sir. I am very sorry. My slides are ready. There is no power. And next time I will share my slides. I request Dr. Dhanesh to excuse me. And you have to see my slides so that you will understand the mechanism of action of medicines.
Thank you, doctor.
See, nobody knows, most of the scientists also do not know the mechanism of action of the medicines. They also don't believe, but we have all data and official papers to prove that the mechanism of the homeopathic medicines can be understood. Thank you very much, sir.
Thank you, doctor. Kindly find another day and another time suitable for you that we can arrange another session with you. And on behalf of IFPH, I thank Doctor for this wonderful session. And I thank you all for attending. And now it's time to start the Malayalam session. Over to Dr. Shaila for the session.